think that's in focus. Hey YouTube, it's Maddie. This is quite shocking, I bet, to see me 2 weeks in Aero. I like filming in this area specifically. It's very nice. Very nice. This week I thought I'd talk to you guys about my breast reduction story, because when I was looking into the surgery, it took me so, I just couldn't find many videos on this subject, and when I did, they helped me so much. So I thought I'd talk about my story. And sorry if I look down, I have my notes down here. And if you have any questions, you can always message me or comment, and I will respond. I may do a question and answer video if this gets enough comments. Growing up large-breasted, a lot of you may know this. If you're watching this video, you probably do. Is very, very, very emotionally exhausting. From the pain and the humiliation of being, you know, the only person with boobs at like 8 years old. I was very proud of my breasts from a young age, but I was also very like, why am I the only one? Blah, 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 blah. And people would make fun of me a lot. I got bullied a lot for having large breasts. It's very hard, and boys always made fun of me. I always liked playing, you know, like kick the can and all those games with the boys, and they never let me play. I was a girl and I had boobs. I had so many symptoms. It was terrible. My cup sizes started from grade 4, I was about a B cup. By grade 7, I was a double D. By grade 9, I was a 32E, and by grade 10, I was a 32 double F. Yeah, it was crazy. Since the surgery, I'm about a 36B or a C. I'm wearing my B cup bra right now. I only have 2 bras, so I'll show you my bras before and after. This was the last bra I had purchased since before my surgery. This is a 32 double F, or double, yeah, 32 double F. I'm very large, you can tell I do not fit at all anymore. I can fit my entire face into this, yeah, in 1 cup. And if you look, this is the larger bra I wear now, the 36C, the larger of the 2 that I own. I like the B cup better, but this is about, if I, you know, this is my comfy bra. It's a little bit big, but this is my biggest bra. And if you compare them, this is this from the front. It's a lot. This bra like that, yeah, it's a lot different. Can like fit a hand in this, not my face. The symptoms that I had after the surgery were migraines, chronic back pain, neck pain, and I had something called kyphosis, which is where your spine curves down and you're basically permanently slouching. You're basically the Hunchback of Notre Dame. There's no way to explain it. That's pretty much it. You're just basically always like this. You can't not be like this. This is what I looked like from the side all the time. Your spine is curved down. And I went to physical therapy for 5 months trying to fix this. Multiple, you know, strength, every day just doing exercises to strengthen my muscles and my back, to keep my back held up. I asked her one day, I was like, well, when I'm done with the surgery, am I gonna have to, you know, come back in for more appointments to straighten my back? And she said, no. Once you have your surgery, you'll be fine. So it got to a point where I just couldn't do it anymore. It was too emotionally exhausting, going 3 times a week for 5 months, and it was just like, well, I keep doing this and it's not helping. So I quit. I just stopped going. The process of getting the surgery was so taxing emotionally. If you're young, I wouldn't suggest starting to try to get the surgery, because I started at a very young age and I kept getting denied, and it was too much all the time. I first started my freshman year of high school, and I'm really happy, or no, my sophomore year of high school. I first started trying to get the surgery. Beginning of my sophomore year, I started to get the surgery, and I went to Mott's Pediatric Plastic Surgery Center, I guess is what it would be called. And the doctor was very optimistic. He was saying I was a perfect candidate. You know, I had the ridging and the shoulders too, that was another symptom. You know, the migraines, everything. He promised that I would get the surgery. He didn't promise, but he basically said that I was one of the best candidates he'd ever seen. And then I was denied. They said it was because I was too young. I was 16. I needed to fit more of the criteria. I hadn't tried physical therapy at this point. So over the next few months, we started building my portfolio, basically. It was kind of like a portfolio. I went to another doctor, another plastic surgeon, to get a second opinion. He was my sister's plastic surgeon. He was the one we wanted to go to the whole time, Dr. Stefani. He's great. He's wonderful. If you are in the Troy, Michigan area, definitely I would recommend Dr. Stefani and my surgeon, Dr. Tribriano. They're very great surgeons, both of them. Dr. Stefani made me feel so happy about what I was doing, and so he explained it in such a way that was so calming, and he explained all of the symptoms and said, you know, and explained why I was having this pain and everything. And if I had developed the same amount of breast tissue at a different rate, I would have been a lot smaller, I guess. It was basically, since I started developing so early, it was like the skin, it was like a rock in a sock. All the tissue went straight down and the skin stretched. You know, I knew exactly what I wanted going in. He made me understand how severe the surgery was, how serious it was, without making me feel upset about it. They guided us through the process of getting approved. And basically what they said was I needed to do the physical therapy, I needed to build a portfolio, and hope that they would accept my case. So, also I needed doctor letters from my pediatrician and from the surgeon. But then that year I was so excited, and I found out, oh by the way, that year I was so excited and I found out I couldn't go to Dr. Stefani because he was out of network, which killed me. I loved Dr. Stefani. He was out of network from the beginning, but they added an extra charge to going to a doctor out of network, so we couldn't afford it. Finally, I went to Dr. Trupiano. The first appointment I had with him, it was very different than Dr. Stefani though. He made me feel like, I cried leaving. He made me second guess myself, which I don't blame him. He really wanted to drill it into my head how serious this surgery was because I was so young. I was 17 years old. And it finally hit me, you know, as I was leaving. Do I want this? Do I not? And I did. Like, I realized I wouldn't be this upset if I didn't want the surgery. So I thank him so much for actually like making me realize how serious this surgery was. I went in for a second, you know, opinion from him again, for a second appointment before the surgery in about June or July. The day I was approved, I was actually at I was actually with my friends at a hookah bar. I wasn't smoking, I was just with them. And my mom calls me, and I started crying when she told me. I was so happy. I was like, I gotta go with my friend. It was the best news I had gotten since I started, you know, the whole process. It was the best feeling knowing that finally I was gonna get this surgery, and I needed it. I needed it so badly. So when I went in for my second appointment with him, you know, he asked me again, do you really want this? Is this what you really want? And I looked at him in the eye and I said, yes. I don't care how I look, this and that, because he literally told us that I would be going from probably a 32 double F, very large breasts, to a small B cup, large A, small B, because of how many grams they wanted me to take out. It was bad. My mom was so upset about it. She didn't want me to be small-breasted, I guess. I was fine. I was happy. I was like, take what if you want to make me flat-chested, like take away all my boobs, I am very happy with that too. Do whatever you need. I can't live this way anymore. My mom told them that she'd actually pay for the surgery if they could make my breasts a little larger than the criteria called for. He, you know, he told her, or the nurse told us, this is why I really liked it. She said he would never do a surgery, meet criteria. He would always do it to make you look the best that you could look and the most proportionate. So when he went into the surgery, he did a wonderful job. So we're gonna go to the day of surgery now. The night before, I couldn't sleep. I was too excited. The night before, I've heard one of two reactions. You're either very scared and very nervous about surgery, or you're just way too excited to sleep. You will not sleep. If they tell you to sleep, get a good night's rest, you will not sleep. I can promise you that you will not sleep. I'm very anxious generally about things, and I was not at all. I have very bad anxiety. I was perfectly excited. I was perfectly content. I was just, you know, up like crying almost because I was so happy. I got to the hospital around like 7 or 8, I don't remember exactly. And my surgery didn't actually start until 11. I was so excited though. I sat in the room. My friend Katie went with me. She eventually left because they weren't allowed to have people in the room. So if you're planning on bringing a friend, unless that friend's driving you home, I wouldn't necessarily say bring them because they can't really do anything and the surgery is very long. I got there at like 7 a.m. and I left at like 7 o'clock at night. It was like a 12-hour process. Nah, dude. They can leave too and come back and get you, but I wouldn't recommend that because they don't know when you're gonna wake up. When I was at the hospital, I just remember laying in the bed, like laying in the hospital bed and just being like, okay, this is it. Like, I'm finally getting this done. I was just so excited. You know, they asked me all those questions like, do you smoke marijuana? Do you drink alcohol? Have you drank in the last 48 hours? Have you eaten? Are you pregnant? They took a pregnancy test. They test your urine for everything pretty much. I don't know if they drug test you, but I know they test your urine for like pregnancy and stuff. They're like, if you don't pee, you have to have a catheter. So I was like, you know what? I'm gonna make something come out of this, 'cause I'm not having one. So I didn't have a catheter. Thank God. I went in unafraid and fearless, and I think that's all you can really do is just be excited. Don't be scared that something, like, don't be scared about complications. Your doctors know what to do if there are complications, and you'll be fine. Don't worry about waking up either. I don't think I woke up. I don't remember them saying I woke. They said, I don't even remember anything after the surgery pretty much. I just remember waking up and being so high. They hooked me up to the IV, and that was, I'm not gonna lie to you, the IV was not as easy as it was, when I had my wisdom teeth out. That was simple because they put you to sleep right away after you get the IV. The IV for this, they put it in my hand, and the first time, I'm not saying this to scare you because the IV is not that bad and I hate needles. They put it in this hand and the nurse picked the wrong hand because my blood vessel popped, which is fine. That's like bruised pretty much. I just pretty much had a bruise. Nothing really happened. So she put it in the other hand and that hand was fine and I was okay. But it's just annoying and it kind of like feels like itchy and stuff, but that's about it. It's just majorly, it doesn't hurt, it's just an annoyance. My surgery started later in the day than expected, but it was fine. He came in and he started marking up my breasts, and he's gonna mark up, you know, he's gonna do about like, this is kind of what it looks like. He marks up like, you know, a little circle around your areola, down, underneath, and then a few things around with numbers and stuff, and he measures your breasts again, and that was fine. Like, that's perfectly, you know, I was very like, he was like, are you nervous, are you excited? And I was like, no, I'm very excited, I just want to do this, I want this done now. And he started laughing, and he was like, are you sure though? And I was like, I am 100% sure, let's do this, let's do it. And he was like, you can do it, Ozzy. So then my anesthesiologist came in, and I don't remember anything except for him going, okay, I'm gonna start putting in the literally I remember him being like, these are the pre-anesthesia drugs. And I remember feeling like liquids the whole time in the thing, and then I just remember like another like surge of like liquid because that was the medication, and I was like, I remember like, I kind of remember like when they started wheeling me down, like the beginning, like when they started taking me down, but like that's about it. That's all I remember. I was passed out. I was probably awake at the beginning. I just don't remember it. Waking up, I remember waking up after the surgery and just crying, because one of the things they tell you is that you will either lose all nipple sensation for a very long time, and you may never even get it back, or you have hypersensitivity in your nipples. I woke up and I could already feel my nipples, and that's crazy. Like, you're not even supposed to feel your nipples for like days or at least weeks after, sometimes months. Sometimes never, as I said, and I felt them right away, and I just remember I was so high, and I started crying, and the nurse comes over, and she's like, what's wrong, what's wrong? And I'm like, I'm so happy, and she was like, why are you happy? And I was like, because I can feel my nipple. All of the drugs, that's all I can say is, I was feeling pressure, not a lot of pain. That's what you feel when you wake up, you just feel a lot of pressure, because you're basically numb everywhere, and she was like, are you okay? And I was like, I ain't drugs, more drugs. That's what I think I said. I think I was just like, I ain't more drugs. So she gave me more. She's like, what's your like pain level? I think I said like a 7. She gave me more drugs, 5 to a 7. It's not that bad when you wake up. Barely remember this though. She gave me food to eat, like crackers and things, so that, you know, my stomach could handle the drugs. It still couldn't. I threw up. I'm not gonna lie to you, and I threw up a lot that night. That was the only night I threw up. I'm just letting you guys know that now. It was first night and it sucked a lot. The car ride home though was fine. Everyone else, in every video I've said, like, oh, bring a pillow, it hurts, blah, blah, blah. You're so drugged up, like, maybe it can hurt, I don't know, I was so drugged up, though, that I didn't feel anything. I was sleeping. I passed out on the way home. I got in the house, you know, I had people help me into my bed, and I was, you know, I was eating some yogurt to calm my stomach so I could take the Vicodin that I had, and I threw up so much that night. And this is about the recovery now. The first night you get home, like after the surgery, don't have people over. I had people over, and they were just sitting in my room, and I was sleeping, and they were just watching me sleep. I was passed out. And then they were there for me when I was throwing up. They have your family there, not friends. There's no reason for them to be there. It doesn't, like, there's nothing they can do, and they're just kind of like sitting there like, what do I do? Just, there's no reason. First 2 days, like after the first night, aren't bad at all. They kind of suck a little bit, but you really don't feel anything from what I remember. You know, I was very like, oh, this is easy, like, it sucks a little bit, but you have, you know, you're still drugged up, and like, it's not that bad. There's not a lot of pressure. And then you have, you know, they give you, I think, like 48 hours before you shower, Your first shower is gonna be super weird, and I had a panic attack because I didn't know there was like gauze all over my boobs and tape, and I didn't know if I was supposed to take that off or leave it on. You take off the gauze, I'm just letting you know from what my doctor said, they called me back, luckily. You take off the gauze, and then underneath the gauze there should be some tape around like your like scars and stuff. You don't take that off. The doctor eventually will take that off. Unless your doctor tells you otherwise, do not take off the tape. You will be Frankentits. That's what I still call myself Frankentits, and I think it's funny. I'm not like making fun of you or me. I'm not making fun of anyone, but you will look like Frankenstein. Your boobs are green and blue and purple and yellow. They're stitched up and they're stiff. They're gonna be stiff and swollen and weird looking. I was happy though. I still loved them. I was still like sending all my pictures, my friends Snapchats of them, like all my girlfriends, and being like, Frankentits is here! Like, I was so excited. When you're in the shower, your first time, have somebody wash and dry your surgical bra for you, and while you're waiting for it to dry, do not wear a shirt. I know that sounds like weird because there's people helping you. Just tell them, like, be like, listen, like, I'm not gonna be wearing a shirt, so I wouldn't come in the room until the bra's done. Because it just feels weird if you want to. Like, it doesn't hurt. It just like, I didn't like it. I didn't like wearing a shirt while my bra was drying. And when you wash your hair upside down like this, because it makes it so much easier. Like, I promise you, it'll be so much easier. And it feels really good to have the water running down your breasts too. Lifting your hands above your head hurts so bad the first few days. It hurts bad the first like month, I'm gonna be honest with you. Also, if you want to take a bath, because I'm a bath person, what I did was I just wore my surgical bra in the bath with me, and I didn't like lay back. I just sat in the bathtub. That was really nice. Sleep elevated. When they tell you to sleep elevated, take that seriously. Do not lay on your stomach and do not lay on your sides. That hurts so bad. It took me about a month and a half before I could lay on my sides because I'm a side sleeper, and it was the best experience of my life the first time. I was like, oh my god, sleeping elevated sucks. It really does suck, I'm not gonna lie. It's the worst part of recovering, but it's the only way you're gonna be able to sleep. I'm just letting you know. It hurts laying on your back like straight down. Don't do that. That's not gonna help at all. Days 3 to 5 are the worst. Like, after days 1 and 2, you're like, oh my god, this is easy. Days 3 to 5 are terrible. They are terrible. You're gonna be in so much pain. I'm so sorry, babies. Like, it hurts so bad. But I have no pain tolerance. A lot of people are like, oh, it's not a big deal. I was walking around, I was fine. Like, I was walking around, but it still hurt really bad. Have their painkillers ready. If you take your painkillers on time, you should be okay. Visitors are much appreciated between days 3 and 5. It's the best having people over because you're in so much pain and you just want to laugh and watch Netflix. I watched so many movies. I can tell you literally that's all I was doing was watching movies and TV shows. I finished all of season 1 and 2, the first part of season 2 of The Fosters during this week. Also, I watched Teen Beach Movie like 4 times, even though I swear I would never watch it. Teen Beach Movie was my favorite movie while I was recovering. Your back's gonna hurt. I'm not gonna lie to you. It's not your back though. That's the tricky thing. It feels like your back and it feels like you're in so much pain. You're like, why is my back still hurting? I don't understand. I just got this surgery so my back wouldn't hurt anymore and now it's hurting even more. It's not your back. It's your chest. I called my doctor and I was like, why? Or they called me like the day after, like, or a few days after, to check up on me. I was like, why is my back? Why? And I was like, I'm so confused, and they're like, no, that's not your back. They just, like, basically what she said is they go so deep into your chest that it feels like it's your back, but it's really just pain in your chest. But it's your back will hurt. But it's your chest, but your back will hurt. If you notice your wound is, like, open, and this sounds like common sense, but I'm an idiot, and I just Googled everything, and I was like, oh, it's nothing, it's nothing. If you notice, like, your wound is, like, and you can see, like, flesh, like, up from underneath, it kind of looks weird, that's called wound splitting. I had that. It's not too bad. It's just, like, I didn't know what it was, so I let it go by for way too long. It's basically, I always get infections no matter what I do. I had so many infections every surgery I've had. It's an infection, and what you need to do is you need to call your doctor and be like, yo, my wound is splitting, and he'll be like, okay, what does it look like? You explain what it looks like, the fact that there's so much drainage coming out of it. I had literally just been putting band-aids over the wound split, where the wound split for, like, ever, and it wouldn't heal. So what you have to do, what I did, which doesn't seem like it would make sense because you're like, oh, I need air on the wound. That doesn't help. What you need to do is, until you can see your doctor and he tells you what to do, put Neosporin on a little like square gauze pad and then put that right there or wherever your wound is split. That'll help, and he'll be like, wow, where'd you learn that? You can be like, Manny Buckshot on YouTube. It's a really good video. Morning and night, twice a day. That's what helped me. a lot. And then I went in and eventually, you know, that's when he told me to do the Neosporin. And then I went in a few weeks later for another checkup to see the wound splitting I was doing. And he switched me over to honey, Manuka honey, which really helped. Where I am now, 6 months in, I am so much happier than I used to be. My boobs are almost completely recovered. Like, I'm really not numb anymore, except for in, like, right here, I kind of am a little numb. I'm still uber sensitive, like, around my nipples. Like, after the surgery, like, for weeks after when I was back in school, I'd sneeze and my nipples would become hard, and I'd be like, what? I still have scars, but they're rapidly fading. They're very thick, though. I'm gonna be honest, they're very thick, but they're fading, and like there's certain areas where they're really thick, and then they're fading in the other areas really quickly. As I said, I had increased nipple sensation, still have increased nipple sensation. They tell you, a lot of people on YouTube, they're like, oh my god, I never want to wear a bra again. I love wearing bras. I never got to wear cute bras. This was the only cute bra I owned pre-surgery, because it had a little jewel. Now I'm wearing the cutest bras I've ever owned in my life, and I love them. And I have really cute bathing suits now too. My first bathing suit, like the first time I went shopping for bathing suits, I cried because it was so much easier. And bra shopping is so much easier, and it's cheaper too. Like, all you people complaining about how expensive Victoria's Secret is, I hate you because this is so cheap for me. I can wear underwired bras now, 6 months in, which is really weird. Some people are like, oh my god, like I can never wear underwired bras again. I just wear sports bras all the time. It really depends on who you are, I'm guessing. I'm perfectly content wearing underwire bras. I love them. I love wearing, but at night I wear my surgical bras still. Everyone else hates their surgical bra, and I'm like, look at me, I'm a G in my surgical bra. It's so comfy. I love my surgical bras. They are everything to me. Where I am right now is I'm extremely happy.